Many families deal with, but often in silence. Bedwetting. It's officially called nocturnal enuresis, and it can be a huge source of stress. But here's the thing, it's way more common than you might think. And what's absolutely crucial to understand from the get-go is that it's almost always a medical thing, not a behavioral problem. Let's dive in and really unpack what's going on.
You know, for so many families, the story starts just like this. Picture a kid, maybe 10 years old, who's totally healthy in every other way, but they're still struggling with bedwetting. There's no big illness, no obvious trigger, just this one challenge that can make both the child and their parents feel pretty alone.
So the big questions are, what's really going on here? And more importantly, what can we actually do about it? That's exactly what we're going to break down, looking at the real reasons behind it and the practical steps that can help.
Okay, first things first, let's get our terms straight. Having a clear medical definition helps us frame the whole issue correctly, and honestly, that's a game-changing first step.
Okay, so the official term you'll hear is enuresis, and the key words to really zoom in on here are involuntary and after an age when control is expected. Right away, that tells you this is a developmental or a physical issue. It is not a kid acting out.
Now, what's really interesting is that this isn't a one-size-fits-all kind of thing. Nope. The huge majority of cases, we're talking 75 to 90%, are what's called primary urisis. That just means the child has never really had a long stretch of dry nights. Then you have secondary urisis, which is when a kid has been dry for 6 months or more, and then it starts up again. That usually points to some different causes.
And this leads us to maybe the most important point of this entire conversation. When you understand the causes, you can finally let go of the blame and start looking for real, effective solutions.
I really want this to sink in for a second. This is not about being lazy or trying to get attention or being defiant. Enuresis is a medical condition. It has clear physical roots. And when you approach it with that mindset, it changes absolutely everything.
So, what's behind it all? Well, it usually boils down to 3 main things. First, some kids just don't make enough of a certain hormone at night. It's called antidiuretic hormone, and its job is to tell the kidneys to chill out and make less urine while they sleep. Second, it could be the bladder itself. Maybe it has a smaller capacity, or it's a little overactive. And third, and this is a big one, there is often a very strong genetic link.
And then genetic link, it's strong. We're talking about half of all cases having a family history of it. If one parent went through it, their child has a really good chance of going through it too. It literally runs in the family, which is just one more reason to take any sense of blame completely off the table.
And here's another thing, it's actually a bit more common in boys. They make up about 60% of cases. Just knowing these kinds of stats can help normalize the whole experience and remind you that you are definitely not alone in this.
Okay, so now that we've got a handle on the what and the why, what's next? Well, the next step is figuring out what's going on for your specific child. And that all starts with a very straightforward clinical assessment.
And listen, this doesn't have to be a big, scary thing. We're not talking about anything invasive. A doctor will just ask a lot of detailed questions to get a good history, do a standard physical checkup, and probably run a simple urine test. It's all about ruling out any other underlying issues and just getting a clear picture of the situation.
All right, let's get to the good stuff, the solutions. This is where we shift from just understanding the problem to actually doing something about it.
And here we go. This might be the single most important first step, before you even think about alarms or anything else, reassurance. Just reminding your child, and yourself for that matter, that this is a temporary phase that they will outgrow. Taking that anxiety out of the equation, that alone can be a massive help. Once you've got that foundation of reassurance, you can start with some pretty simple lifestyle changes. These are practical things you can start tonight, like cutting back on drinks after dinner, making sure the bladder is totally empty right before bed, and easing up on sugar and caffeine, which can sometimes irritate the bladder.
Now, what if those first steps just aren't cutting it? Well, it's okay. Management usually goes down one of 2 main paths. You've got your behavioral approaches, which are all about training and support, and then you have pharmacologic or medication-based treatments.
So, on the behavioral side of things, we're talking about strategies like counseling to help with any emotional fallout, using things like sticker charts to celebrate the wins, doing exercises to help stretch the bladder, and of course, the famous buzzer alarm system. That's just a little device that senses moisture and makes a noise, helping to train the brain to wake up when it's time to go. And if you and your doctor decide medication is the right path, there are a few main options on the table. Desmopressin is basically a synthetic version of that hormone we talked about, helping the kidneys make less urine at night.
Oxybutynin is great for calming down an overactive bladder. And then there's imipramine, which is usually considered a third-line option if the others haven't worked. Whew. Okay, we have covered a ton of ground here, from the what to the why to the how to fix it. So let's boil it all down to the absolute key takeaways you should remember. All right, let's wrap this up with the most important things to remember. If you take anything away from this, let it be these points. 1. Bedwetting is a common medical condition. 2. It is never, ever the child's fault. 3. Your reassurance is the most powerful tool you have. And 4. There is help. There are effective solutions and support systems out there.
And that really leaves us with one last big idea to think about. While all of the alarms and treatments and strategies have their place, what if the most powerful treatment of all is just simply trading in all that frustration and anxiety for a little bit of compassion and a whole lot of understanding?